Intractable Plantar Keratoma. Have you got a hard spot on the bottom of your foot that hurts, particularly if you walk barefoot on a hard floor? The most common cause for this is what is known as an intractable plantar keratoma, or commonly referred to as an IPK. This is a benign condition that develops as a result of cystic degeneration in a calloused area. In simpler terms, there is excessive pressure under one of the metatarsal heads. The pressure itself will initially cause a callus to form. The callus itself may or may not be a painful condition, some require treatment, many do not. The IPK will result from excessive shearing forces occurring in the center of the callus. Specific causes of intractable plantar keratoma. The formation of this cystic lesion can be caused by a number of structural problems in the foot. Elongated metatarsal head. Excessively short first metatarsal head resulting in an IPK under the second metatarsal head. Plantar flexed metatarsal. Shape of the metatarsal head such as in an enlarged condyle. Hammer toes which place a retrograde force on the metatarsal head. Lack of fat on ball of foot. Common conditions that may mimic an IPK is a plantar wart and a porokeratosis. Treatment of intractable plantar keratoma. Conservative care. Shoe selection, look for low heels and cushioned soles. Pads and cushions, cushioning or padding the growth will reduce pain. Avoid using medicated pads, especially if you are diabetic or have poor circulation. Professional medical care, using the services of a podiatrist to trim the growth. Orthotics-redirects the excessive pressure of the affected metatarsal. Surgical care. There are surgical approaches for the treatment of intractable plantar keratoma in those individuals where nothing else gives satisfactory relief. The problem here is that the success rate is not as high as it is for other foot procedures. Perhaps the most common procedure is one where the offending metatarsal bone is surgically broken and the head of the bone is elevated in order to reduce pressure. Another popular procedure is a condylectomy where the enlarged head of the bone is shaved down. In summary, an intractable plantar keratoma is a condition that generally responds quite well to conservative care, in many cases just a change in shoe selection. Always try the simplest things first. If you cannot get the relief you are trying to achieve through conservative means, then discuss more invasive options with your doctor. Read the complete article at www.foot-pain-explained.com.